of Drmizan Coaching LLC. And today I sort of thought, I get a lot of emails and questions about this. And it seems to be an epidemic, and it's been an epidemic for many, many years now. So what's been going on in the United States ever since really 2020, and I think we all know what happened around 2019, 2020, that affected, the entire world, and really the global population and healthcare systems were really just destroyed because of it. However, in the United States, doctors are quitting in droves, and this is not an exaggeration. The recent studies, and I'll link them below once I get home and I have a chance to edit this on my computer. But thousands upon thousands of doctors are quitting year after year, and the numbers are not slowing down. And so this is extremely concerning for many, many, many reasons. So, and I think we all can understand why this should be a national crisis. Like, in my opinion, if anyone in the political higher ups are watching my channel for whatever reason, please contact me. I'm happy to help out, happy to give some advice. But really, this should be a national emergency. And so what's happening is that it's estimated that about 40%, that's 40, so almost half of American physicians, doctors, MDs, DOs, are either thinking of quitting or they're retiring early. So, what I always tell people is that I just saw the trend. I saw the trend occurring before a lot of people in my cohort, right? I'm in my early 30s. I'm a licensed family medicine doctor. I very quickly exited the clinical medical world, not because I was not a great doctor. In fact, I was the most requested primary care physician, or PCP, at my institution. And so why are good doctors quitting? It's simply because the burden is becoming way too great for physicians in the United States, and I cannot overstress that enough. And I feel like, when I was doing some research, hi, thanks for joining. So when I was doing some research into this topic, I found that there aren't that many videos on it, and I was extremely disappointed by my colleagues. Oh, that's too bad. This man's shopping bags flew into the lot. Oh no. Leave them. It's an elderly man. I kind of want to help him out, but he's really far away now. Okay. If he comes back, I'll give him my grocery bags. Anyway, so what's happening in America, for those of you who just joined, is that it's estimated that 40% of American doctors are going to quit very soon, within the next 5 years, or they're going to retire early. And so the reasoning behind this is multifold. It's how it usually is. Number one, administrative burden. So when I was in clinical medicine, this was about 5-6 years ago. I started my business a long time ago. So what I saw was that our yes, Spring Miriam, good morning. Hello, you are indeed first. So what happened is that very slowly we stopped doing doctor work. We stopped providing medical care, and we really were just chart monkeys. Like, we would just write note after note, and every single note had to be extremely thorough, extremely by the book. And so people just became more and more burnt out. Like, I remember my own colleagues, like, they would just take sick days, and they would take administrative leave or extended sick leave. And this was in the beginning of our career. So, now fast forward. So thank you. So what happened is that, doctors were just saying, look, most doctors, they would finish residency, they would go into private practice or whatever. Oh, I am American. I grew up I'm a second generation American, Siobhan, but thank you for noticing, I guess. I'm a second generation American, raised here. So, and Shivam, if you do want to become a physician, our email is in the profile. I help a lot of international students like get residency here in the United States, medical residency. Um, so, what would happen is that, number one, there was administrative burden. Number two, the amount of time that we were given to see patients decreased tremendously. And so, it went from 1 hour per patient to 30 minutes, and now I believe it's 15 minutes. So, 5 minutes for an entire patient encounter. And so for those of you who are wishing to become physicians, it's a lot harder today than it was 10 years ago, 20 years ago. Like I have family in medicine. They're, like uncles, aunties, etc. It was a lot simpler back then. You kind of just take a test, you go into, medical school, you go into residency, you're done. But now you're basically a general of an army. You have to commandeer nurses, you have to commandeer, MAs, etc. You need to do a lot of administrative work. And also on top of that is electronic health records are insane. Like, a lot of, back in the day, like back just 20 years ago or 10 years ago even, you would just write your patient note and you would go home. That's really it. But now it's like doctors are literally just, writing note after note after note. After every event, you have to write an event note, right? So it's becoming insane. The next reason is simply that there's no money to be made when people become physicians in the United States. And this is an insane thing, right? Because I feel like the stereotype is that doctors are rich, doctors make a lot of money, blah, blah, blah. So this actually isn't true anymore. So, if you look at the average income of a family medicine doctor or a internal medicine doctor who goes into the clinical world, so you become a clinician, because of inflation, the amount of money you made was a lot, right? So the delta. So basically, if you made 200K back in the 90s, that was enough for, to raise an entire family, to, to raise like 5 kids, to send all of them to college, to buy like 2 luxury cars, to buy a giant house. Only one individual had to work. Now in 2025, $200,000 is not enough, right? Like we're all of us who are currently looking for a house or, trying to progress in life, or we're starting to understand now, like the millennial generation is starting to understand that, it's nearly impossible to live the life that our parents lived. And what's difficult is that our parents' generation, I feel, don't really understand that, right? Like they're like, oh, just, work harder or get another job or, ask for a raise or something. But the economy is just so terrible right now that even a physician, even if you're a doctor married couple, you're basically going to live a pretty good life. That's it. Like, just 10, 20 years ago, one single doctor in a family could provide and, take care of the entire family on their own. But now it's like even a doctor couple, it's like you can buy like maybe like an above average house, right? And, and the problem in the West is that people are now deciding not to have children, right? So they're deciding not to have children because they think that they need a certain amount of income. So there are a lot of things going on. So kind of dialing back, and if you guys have any questions or any concerns, if you are, in the healthcare world and you feel the same way, please leave a comment. And our team looks at everything, and I respond to pretty much every single comment that you guys send me. So that's really what's going on. As of 2025, physicians are burnt out. We're seeing way too many patients. We're not getting, the pay has not increased, even though the cost of living across the US has increased. And we just have so much administrative burden. Like we have so many notes to write. And here's the kicker. Most physicians, like, physicians that are in the clinical world, and this used to be me, right? So you're sort of put into this very narrow world view. And this is something that my non-clinical friends don't really understand, because when you think of a doctor, you think, oh, they're so smart, they're so that. We're just smart in one thing, you know, like we just like, you know, spend decades and decades studying, not having a social life, not learning basic economics or basic social skills. And it has affected generations of doctors. And I see this on a daily basis. Like when I interact with other physicians, they don't know much of anything, right? Like they're great doctors, right? Like a very good neurologist or a very good cardiologist. But if you ask them, like, you know, can you tell me anything about, you know, investing, or can you tell me anything about geopolitics? They just don't know anything. And the reason why, again, is connected to the initial, is to my initial thesis, right? Like it's simply that being a physician in the United States is it's so difficult that you don't have time or mental capacity to do anything else. So what are my hypotheses here? Or my prediction is that the American healthcare system is going to implode very, very, very soon. So if you're in the United States and you're watching, then, you know, you kind of have inside information that no one else has. I would highly encourage you to like, subscribe, share my channel. I have a video actually where I talk about the US healthcare system and how all these processes are just destroyed. Like it's been destroyed, and like people don't really, I think people aren't really aware today, but they will be aware very soon. And especially now with like the trade wars going on, with you know, President Trump's tariffs, I really don't think the American healthcare system is going to get any better anytime soon. And again, this is extremely sad. Like I'm not happy about this. Like I'm extremely saddened by this. So what I think will happen anyway, so I think that's what's going on. And you know, for those of us in the healthcare world, we're seeing it in real time, right? Like we're seeing less and less doctors. We're seeing more mid-level providers that are being given independent practicing rights. Why? Not because they're as good as we are. No, like they're mid-levels, they have their place, we have our place, right? Nurses, for example, know more real world stuff than doctors do. Everyone has their place. But what's happening is that hospitals and clinics are now being bought by private equity groups. They're being run as businesses instead of healthcare institutions. And so if you can have like an NP see 20 patients and pay the NP like half the salary of a doctor, why would you hire doctors anymore, right? Even if you get like one lawsuit every year, that's totally worth it, because the insurance companies are making millions of dollars off of each of us providers, all right? So my thing here is that, like, you know, all of us providers, MDs, DOs, PAs, NPs, RNs, we all need to, you know, cliche as it is, we need to rise up. Like, we need to talk more about this. We need to be more vocal, and we need to demand that institutions are, again, provider owned and operated. Like, no more private equity groups, you know, turning a Kaiser Permanente into a McDonald's. Like, you know, it's not about turnaround. It's more about adequate patient care. And, you know, and again, like, you know, I'm an American. I love the United States, and that's why I'm saying this, because I want my home country to get better. And, you know, because I do global medicine, there are many other countries that do healthcare a lot better than the United States. And that's really concerning to me as well, simply because the US is the richest country on earth, right? So why are we not able to implement those same methods that other poorer countries use, right? And the reason is capitalism, right? Like, the reason is because a few people make money off of this corruption and out of these, you know, arbitrary deficits. But anyway, so that's what's happening right now. So the latter half of this talk is really, so what, right? So what do we do in this situation that we're in? So if you are a physician such as myself, who knows too much, you've decided, like, look, I can't do this anymore. I can't do clinical medicine, not because I don't want to take care of patients, but really because this isn't good for my personal life. Like, it's not good for my work-life balance. My institution is not helping me. My institution doesn't care about me. There are non-clinical professions out there. There's consulting, there's medical writing, there's being an MSL or a medical science liaison. There, like you could be any type of physician advisor for thousands of companies around the US. I do everything actually. So, and I also started my own business. I have a video on my channel on how to create your own LLC. Just look for LLC or business in my video list. But doctors can do so much in America. Like you can start your own business, you can start your own consulting or coaching business. You can be an advisor for so many people or companies. There are many things that physicians can do. You just really have to look for it. And now, because it's when I started my own business and I started doing coaching, there was nothing really. Like I remember I was, networking with random people on LinkedIn who was sort of in a similar boat to me. But now, as of 2025, it's like there are companies built off of this idea. I'm not smart enough to start my own company yet, but I do just run my own coaching business. If you do want personalized help, you can work with us. Our email is mazancoaching@gmail.com. And we're happy to help you out. Like, we're happy to guide you, give you resources. It's a really great partnership because just if you talk with us once, then you'll know exactly what to do with the rest of your life, really. So, I'm an example of a success story, I guess, like where it's like I saw like, look, like this isn't for me anymore. I still want to be a physician helping a tremendous amount of people. And that's what I do. And I also, because of my business, I also help doctors and nurses, PAs and NPs. So, again, if you do want to work with us, just email us at mazancoaching@gmail.com. So, in summary, what's happening in the United States healthcare system is that physicians are quitting or they're retiring very early because of increased administrative burdens, increased patient load, horrible EHRs that, we have to write event note after event note, progress note. And, and also the legal system is just targeting doctors for the tiniest things, creating frivolous lawsuits. So there's a lot of pressures here for physicians in the US. And the problem is that the institutions themselves are not really helping physicians. Like paychecks are not increasing, but the cost of living is increasing. So it's like, if you're a college student who, thought like, oh, if I become a doctor, I can have a very easy life, make a lot of money. I don't think that's the case anymore. Like, if you're truly passionate about being a doctor, go ahead. No one's going to stop you, but my job is really just to give you a dose of reality, like, from the other side, like from somebody who's made it. And I'm telling you that, like, for most of the United States, it's like you're basically going to be middle class, like if you become a physician. So there are other jobs where, and with $500,000 in debt, right? So like medical school is not cheap. Residency, you make pennies. You make less than minimum wage in residency, right? If you count it by hours. So there are a lot of negatives to becoming a physician right now, which didn't exist 10, 20 years ago. But again, hopefully this will be a wake-up call. Hopefully someone will see this video and do something about this. I'm not powerful enough to do anything with the US healthcare system, but I'm at least one voice, right? Like I'm one physician voice in a sea of complacency. And my ask here is for other doctors to, connect with me. We should make sure that people are aware of what's going on. So yeah, anyway. So again, this was Dr. Drmizan, MD. I run Mazan Coaching LLC. You can contact us anytime. If you do have any video ideas or any comments, leave them below, and we'll be happy to see them and read them. All right, take care. That's all I have for you guys today. Until next time, bye.